Well, there we go. We had about a minute of some technical difficulties, but I'm getting smarter and smarter with my computer skills, and I was able to solve it on my own. Anyways, good evening, everyone. This is Dr. Ellithorpe with Ask the Doctor Anything from Tustin Longevity Center, and we are doing this every Tuesday night at 6 o'clock to 7 o'clock. We are in Southern California. The name of the town is Tustin, and the center, the medical clinic is Tustin Longevity Center. We do this for educational purposes. This is not meant to replace seeing your doctor or getting advice for management of your personal health care through the system. It's just to give you ideas and ways to understand how we think about certain uh, uh, symptoms, problems that people have, and how we approach them. We are very, very skilled in the functional medicine, natural, integrative medicine, complementary, alternative medicine protocols. We are standard trained medical doctors and physician assistants here, and we have boatloads of decades of experience, well long before all the YouTube and even computer came out. We've been doing alternative uh, methodologies in approaching our patients. I myself did a second doctorate in integrative medicine back in the 1990s. So I have two doctorates. I don't know if anyone recognizes the doctorate I did, or because they closed that place down. It was called Capital University of Integrative Medicine in Washington, D.C. Oh, I think maybe a few hundred of us went through it. We had the world's great people teaching us from all around the world coming to Washington, D.C. in the 1990s. And uh, they were just attacked by the standard medical world, and funding and the future of it was poo pooed. I think finally around 2006, after being open maybe 12 years, it finally closed its doors. But fortunately, the Lord helped me to get my full course done and all my additional integrative exposure and teaching with worldwide training in integrative, natural, Bach remedies, essential oils, electric medicine in the sense of energy medicine, um, applied kinesiology, acupuncture, all these wonderful methodologies that we were able to add in addition to our standard allopathic medical training. So that's what we bring to you tonight, our experience, and we look at your questions. There's two ways to get a hold of us. You can send in your email questions if you go to tlcdoctors.com, and there you can get on our newsletter, tlcdoctors.com, and then you can type in that you want to be on the newsletter. There's a link for typing this in. There's a limited amount of characters, so you can't send me a whole medical history, but there's enough to get your questions out there. And then you can do live chat here, and that will probably be enough to at least get your question and see what our general impression of these situations would do. Well, before we get started, I want to thank you for joining us. And if this is of value to you, please like and please subscribe and like that, hit that like button, and that'll help get it out to more people. So let's begin with our live YouTube chat questions. And the first one is coming from tonight from Gwen. And she goes, "Hi, doctor. How much progesterone is in each click of TLC's progesterone? And how many clicks would be needed to support a potential pregnancy?" The concentration of our progesterone is 200 milligrams per milliliter. That means each click on the toppy click, because we put it in a clicking thing where you dial the bottom and it pushes slowly up to be 4 clicks equals 1 full milliliter. So if you only use 1 click, then that's 50 milligrams. If you do 2 clicks, that's 100, 3 clicks, 150, and then 4 clicks is a full milliliter, and that's 200 milligrams. Now, there is no real statement about what supports a pregnancy other than training from my medical school and uh, residency. Was there were times when they would give progesterone, and I think it was a 200 milligram suppository vaginally. If I recall that right, it's been more than 25 years since we've done that. This is a topical cream, although it can be placed vaginally because the cream is just Eucerin cream. Uh, but you should have your OBGYN doctor and talk to them about it. These are just my general historical experiences with it. And that is the concentration that we use. Women have sometimes trouble producing enough progesterone in the very early parts of the pregnancy until the placenta is well established and safe for the baby's growth. So that's the most important time in the first trimester in general. But talk with your OBGYN, and that's what our concentration is. Hope that was a help to you. She goes on to say, I use 2 clicks daily for the second half of my cycle. Yes, if you are a woman in today's stressful world, remember cortisol is a stress hormone response, and chronic stress is never healthy. The cortisol was meant to be these episodic bursts in your system that will help awaken you in the morning, arouse you, and help mobilize some early stored glycogen to be broken down into glucose to get you moving and energy for the day. But you can mentally be under so much stress or such a angry, negative, bitter, or worrisome attitude that you can have chronic stress. And of course, the world news and life situations may generate this with today's news media being so abundant. Unless you have some way to find peace. For me, I have the worldview of a Christian, and so I read my Bible every day. I have my Bible sermons, my podcasts, and all these things to help me with topical and verse by verse guidance to address certain things. I have a little thing on the wall called, let's see, it says Bible emergency numbers, and there, it'll have sorrow, fear of failure, and so all these Bible emergency numbers, are what I do. That cortisol stress normally will come out in a girl and suppress the ovulation through the action of your hypothalamus pituitary axis. The cortisol will block follicle stimulating hormone, and then you won't get the signal to ovulate. And if you don't ovulate, you won't make progesterone. So we tell women to use progesterone from day 15 to 25 of their menstrual cycles, just to be sure, if that was a stressful month, that you're still getting a good progesterone signal into your body so you don't develop estrogen dominance and all the problems that it develops. Jennifer says, hi, Dr. E. What are healthy fats with more calories to help a healthy elderly person gain weight? Already doing keto carnivore, juice plus, but need more calories. What else? Well, I would use fat in the sense of butter with the butyric acid in it. That's why it's called butter, because of the butyric acid primarily in it. But there's, other fatty acids in butter, but primarily butter has a lot of cholesterol in it. There's 9 calories for every gram of fat to every gram of carbohydrate. Vegetable has only 4. So 9, to 4. That's a tremendous ratio, the higher the fat. But if you give the fat, you have to make sure you're giving a digestive enzyme that has some ox bile in it to help them digest the fat and emulsify it to carry it along in the gut. So I would dribble warm butter over all the vegetables that they do eat, all the steak. I would butter their steak. I would butter their salmon. I would butter their chicken. I would butter their uh, pork chops, all that. And then beyond that, avocados would be a good source. You could get raw dairy yogurt. That would be another good source for calories and fat with protein. But I don't think I would be fearful in an elderly person to let them have things like complex carbohydrates such as yam, but you would put a lot of butter on it and salt. Put in some squash, cooked squash, and a lot of butter and salt. Preferably, the salt would be Celtic or Himalayan salt. Those kind of things would be my suggestion, Jennifer. There are medications like steroids, and one of the ones that's approved for weight gain is Megace, Megace. That can be used for a month to help stimulate hunger. Let's see. Uh, Besides olive oil, butter, and avocado, so those are the ones I referred to. Really, um, I just don't think there's anything in greater value than to just butter up these things and add in yam and squash and maybe some cooked beets, those kind of things that are very well buttered up. I don't think the potatoes or the um, peas, corn, and carrots, these are not really great sources. Um, Hopefully that's a help to you. We do have now health coaching, so dietary peculiarities with our health coach can go through these minutia with a scheduled health coach visit with my personal nurse here, Terry. Has now received and been doing for years her health coaching, and it's turning out very well. Just call the front office, 714-544-1521. The next question is Christina. Hi, Dr. Rita. My 5-year-old boy has a swollen lymph node behind his ear. What can I do to help? His doctor can't find anything. Well, behind the ear, yeah, hopefully you don't have any pierced earrings or anything like that. Is he wearing glasses, and does it rub there, and is it rubbing over the root of a hair, letting the bacteria go down the core of the hair follicle? Are there any little bites or if there's like a pet dog, maybe a flea bite or something, or maybe he got some chiggers playing in the grass and he had some little skin bites? That little post auricular lymph node should go away. Now, what we usually do is we say, don't touch it, because the more you rub these surface lymph nodes right over that hard mastoid bone right there behind the ear, the more easier it is to become a reactive lymph node and swell up. So try and not touch it. You could use moist, warm compresses. The thing I would do is I would wash the hair in Selsun Blue. That's a selenium-based shampoo, and it's antibacterial. And then you could use Argentine Silver. Argentine Silver is a spray, and you can spray the hair, kind of comb it and spray with Argentine Silver, and all behind the ear with the silver, and that's an antibacterial. And then just watch and see if it'll go away after a week or two. If not, you have to go back to your doctor or the dermatologist and look at it. But we have posterior chain, and then we have the anterior chain lymph nodes. And the posterior ones are usually from something in our hair, that follicle or something that got irritated. And then the next question is, yeah, she said it's painful, so don't touch it, okay? Deanna Smith says, hi, Dr. Rita. Have you heard of HerScan breast cancer ultrasound screening, which avoids radiation? Yes, that's been around quite some time. This is a ultrasound, and they have kind of like a stick, and they kind of go around the breast in quadrants. So they quadrant the breast off, and it will send a sound wave, and that sound wave will then uh, reflect back at a quicker pace if there's something firm or nodular or calcified in the breast. I suppose it's reasonable, and there should be more research money devoted to that. But we have the mafia called the pharmaceutical system that has bought off the FDA and the physicians and the medical schools. And this mafia pharmacy in general has uh, made it almost impossible for doctors to think outside the box and work. I found a way because I love my patients, and the Lord said He will lead you into all truth, and that also for me is truth in medicine. And He has kept me in the right zone all these years, keeping my patients living long without the incidence of any cardiovascular disease or cancer or new onset diabetes or Alzheimer's compared to the world's incidence. I'm infinitesimally less so. And so I give God the glory for Him guiding me this way. That ultrasound should have been studied and compared in large patient populations with money that we would allow for tax research, uh, and with a board of internal review IRB doctors that would say this is safe, let's do it, but the money doesn't show up. So let's get rid of this criminal mafia. Hopefully JFK Jr., please take responsibility for the healthcare system you have allowed in this country. You've allowed the mafia. I have allowed the mafia. We have allowed a mafia to take over. So call 202-224-3121, and with respect and kindness, speak to the switchboard lady who will say, Capital Switchboard, how can I help you, at that number? And just say, let me speak to JFK Jr.'s office and let him know what I think about, funds for doing non-risky research on breast with the ultrasound her scan, or whatever you want to say, but start calling them every week. And you take responsibility for turning this around, and call 202-224-3121. Let's see, what's the next one? Amela says, after tonsillectomy, my daughter has thick mucus in her throat 1.5 years after surgery. What could be the reason? Most likely she's drinking too little water. And soda pop and these so-called Gatorade drinks, which have bromelain in it, these are all criminal productions just to sell stuff and market to you people. Water is what God wants us to drink. Drink water. And she has to find out her blood type. If she's an O type blood, the American criminal mafia has paid off through lobbyists the food industries that want to pimp at us oats and wheat grains so that they can churn out these junk food, sugared up cereals. And we have our corrupt Congress and senators who have pimped themselves out to the lobbyists' money and their treats. And so we have this glyphosated with insecticides intercalated into the genome of the seeds, and we eat it. The genetic modification of the actual wheat germ itself into the dwarf wheat, primarily shorter, more volume producing, money producing wheat stalk. And it's inflaming and making thicker mucus in our kids and ourselves, and creating lectins that scratch the internal lining of the gastrointestinal system from your hypopharynx all the way down to your gut, with little scratches on the cells. So the same for dairy. The pimps and whores of our government have allowed for federal regulation of requiring homogenization and pasteurization of all dairy. This is always under the auspices of doing some do-good garbage. They sell it to you. You need it. We, the government, love you. We, the government, want to protect you. We, the government, will watch out for you. And under these do-good clauses, we have to pay for taxes, and fat bureaucrats who just middleman suck off of our tax dollar create no good value with all these rules on dairy that destroy the dairy, make it more inflamed, refuse to finance research that shows homogenization and pasteurization literally turns milk into an inflaming, autoimmune triggering, gut hindering, mucus producing item. But no, they will never allow that. So call JFK Jr. and see what the man is made of, and see if he'll start really stopping mandatory homogenization and pasteurization, or at least allow for much more vast availability of raw dairy. And just like people who are allowed to drink alcohol, that's a toxin, causes known liver disease and addictions. Let people who want to use raw dairy under the, their trumped up worry that this is potentially more dangerous to drink bacteria-laden dairy, drink at your own risk like you do with dairy. I mean, alcohol. Anyway, you got to make your government serve you, not you follow them. So that's what I think is causing her thicker mucus. So she has to take responsibility for that. Plus, she has to check her sugars and insulin, because I tell you, most of the teenagers, I would say 99% of every teenager I see is already in metabolic disease. They're already on their way to their high blood pressure, diabetes, or heart disease, and eventual Alzheimer's and dementia, because their insulins are in the teens. And our corrupt government, again, the whores that pay off pharmaceuticals and food industry to allow the consumption of these carbs that trigger excess insulin production, that keep our kids always up and down in their moods and wanting to snack and carbs, and then insulin crash, snack and carbs, insulin crash. This is a pimping and hoard project that our food industry knows, our pharmaceutical industry knows, and it is just destroying the health and the immune system of our children. And the ranges that we tolerate on the lab, your uninformed doctor and your uninterested doctor to do any extra work for health's sake for their dear patients, they could have found out about hyperinsulinemia, which we've been measuring insulin here for more than 35 years. So I don't want to hear anyone say this is new, or this thing about low carb down under. I'm so glad they're doing it. But there are some doctors who have actually been warning us about this since the mid 1900s, 1950, when Dr. Yudkin wrote the book Pure, White, and Deadly. But of course, the hoard out, pimped out media suppressed his book and praised the fake Ansel Keys, and supported a cholesterol theory, and hurt America for at least 2 generations with this low fat, no fat diet that has harmed all of our cell membranes. So, Emil, have her stop the grains, have her stop the dairy, and find out her blood type, make her drink water, find out what her fasting insulin is. Gwen says, one more question about potential pregnancy. Could systemic enzymes have any negative impact on a potential early pregnancy? I'm 41. Thank you. Gwen, I don't think so at all. It will, in fact, make the viscous cervical canal passage of sperm more fluid. So with the natural digestive enzyme when you eat and systemic enzymes, I can't imagine it would do anything other than bless your potential for pregnancy. Amela says, the FDA says it will ban natural thyroid medication in 1 year. What alternatives will we have? I am worried. Then get on the phone and call 202-224-3121. Take responsibility for your health, for your local government, for your state government, and for your federal government. Call them every week and tell them what you think and flood them, because there is no meat to their argument. This has been argued for decades. The synthetic synthroid was, I think, FDA approved in 1956, and we have been using desiccated animal or dried out animal thyroid concentrates since right around 1900. So this is just like eating a piece of hamburger or a piece of fish or a piece of chicken or a piece of pork chop. So you're eating a piece of their thyroid glandular, and God's very consistent in the production and gene code for developing the gland and its consistency. So you get on the phone. The lawsuits have already been argued. There was a big 1990s lawsuit between Synthroid and Armour Thyroid. Synthroid argued that the animal thyroid gland was too variable in the concentration of the T3 and or T4. And it turned out with studying and testing that actually Synthroid, the man-made version, was more variable, and the court was law against Armour Thyroid was thrown out. So this is just legal lawfare, and the lawyers who pimp themselves out just to make money for any cause. We should have moral lawyers, moral doctors, moral teachers, moral policemen. They have to answer to God and obey, because God is watching. Because left to ourselves, we'll just go for the money and we'll pimp ourselves out for anything that gets us another dollar, another trick, so to say. Yeah, I'm angry about this. Mono says, Professor Brian Peskin, not a fan of fish oil, neither am I, and I've met with him personally. He's been to our clinic, and we have been using the parent essential oils for years and years, decades, actually. So what are my thoughts? Yeah, he's one of a very few people who are doing what is right, not for fame and for money, but he has done the studies. My father was in Armour Food Research team on fatty acid specialties, and he's the one who back in the 50s was seeing the corruption of this cholesterol theory as the cause of heart disease, and hydrogenating fats and trans fats, and trying to make TV dinners so the fat in the meats wouldn't rancidify and they would last longer in storage, frozen, without tasting off. So they would hydrogenate all the double bonds on the carbon structure of the fatty acids. And fish oil has dexahexanoic acid has 6 double bonds, and the EPA has 5 double bonds. But the Professor Beard and his wife, who found the only 2 essential fatty acids, linoleic and alpha linoleic, they were discovered, I think, in 1927. These are the only 2 human fatty acids that are essential. And you get them by eating your egg yolks and your meat and your fish and your chicken with the skin on it, and pork, and in some nuts and seeds. But when you hydrogenate them or cook them, you turn all that rich source of linoleic acid into hydrogenated damming molecules. And that's why your ignorant, undereducated doctors and news people and housewife talk and podcast people are talking about bad linoleic acid, omega-6. And that's only because God put it in almost everything we would eat so that we could repair our cell membranes, our skin, our brain, our toes, our heart, our lungs, and repair ourselves with the cell membrane fats to make them fluid and hold their protein receptors in place, and yet have fluidity along with cholesterol fats. But don't go to medical school, kids, if you don't become a chemist. Major in chemistry, biochemistry, and get your statistical, math and things, because it's too hard. And so they've watered down the entrance to medical school. And we have a lot of people who just aren't really capable of being good doctors that can publish anything, or critically review a article and understand the difference between relative risk and absolute risk, and they're a pushover for the few highly paid, undervalued, pimped out scientists. Because most of the people are admitting that most science that's published in these days is hoard out science, and not good. We saw that with COVID. We saw how they demonized ivermectin and hydroxychloroquine, and they published fake studies on hydroxychloroquine and ivermectin there wasn't even the company Surgisphere that claimed this big publication in the early 2020s on it. Was a false organization, but you don't hear a thing about that. But boy, did all the mainstream media suck that up and publish it, because some mastermind of the people who pimp out all the stuff to make all the money on our sickness told them to do it. So you have to know your stuff, and you have to know your healthcare providers, and your accountants, and your teachers, and your dentists, and your doctors. You have to know if they are answering to themselves or to a higher order for their moral choices, no matter what their patient's faith or belief or political status is. We have to do what's right, no matter what. Even in Proverbs, it talks about, I should pick that verse out, that the righteous man will do what is right, even if it's to his own hurt. So if you make a pledge and it turns out the situation doesn't work out to your favor, you still have to keep your word and pay your pledge, even if it's to your own hurt. And that's what God-fearing people from the Bible should do. Now, not all people who claim they're of the Bible or Christians really believe that and practice it. They just take the label like a rhino, Republican in name only. So life is hard. You got to figure out what people are truly all about. So yes, Professor Brian Peskin puts out a wonderful product, and you can get it here. That's what we use. Now, we don't provide to the general population. Again, money isn't my goal. The Lord provides our income, and it's adequate to do what we need to help our patients. Now, if you show up at my clinic, my staff in the vitamin shop is not going to say, "Show me your papers." They'll sell you whatever you ask for. But in general, we don't have an internet where we're just mailing it out to anybody who calls in. We are trying to preserve the exclusivity and the uniqueness of our care with providing for our educated class of patients and friends. Let's see, what's the next question. Amila says, after a sore throat, 5 weeks after, still her daughter's right side is swollen where tonsil used to be. No pain, no fever, no strep. What could it be, and when should it go away? Well, it should have gone away, so I would go to your doctor and find out why it's still sore there. Without fever and chills, it would be unlikely that there would be an abscess there or anything. But no, if we're talking a month since a sore throat and you have a localized soreness, then I would go see your doctor and have that checked with the white blood cell count on a blood count. All right, let's look at some of these internet email questions. So Mary asks, is there a natural laxative that's in liquid form for someone on a restricted diet? That's easy. Go get vitamin C powder, or get buffered vitamin C capsules and just crack one open and put it in your mouth, or put it in some water and drink it down. Vitamin C is a natural laxative. Somewhere around 4 grams will give you looser stools if you're not used to it. But I go through a jar of buffered capsules because it's also helpful for stress, and I live a life of stress. I don't know anything other than stress in my life, but I need a lot of vitamin C. So that would be what I would recommend. So We have Vitality. See, that's a powdered form that has a jar top and with a scoop if you don't want to open up little capsules. The other thing is we have magnesium citrate powder, magnesium glycinate citrate, and that magnesium has both a long and fast acting magnesium for absorption, and you can mix that with the vitamin C, and that'll definitely move the bowels. And the next question on the email is from Shannon. My daughter is 16 years old and constantly gets sick out of about every other month with a recurring infection of some sort, usually of the sinus, ear, or throat. She has always had enlarged tonsils and gets tonsil stones. She also has cyclical nausea. Trigger is unknown. I'm not sure where to start with addressing her health. Well, it's likely with cyclical illness. You know, when a woman ovulates every month or attempts to ovulate, she may not ovulate with stress in our current society with the way things are and all the toxins and sugars and junk food that will suppress the immune system. I told you I would say 99% of the kids today in their so-called healthy diets, they're getting their junk food fixes and their blood sugars are already in the pre-diabetic ranges. Their hemoglobin A1Cs are already knocking on the door of diabetes, or rather pre-diabetes. And their insulin, blood sugars, hemoglobin A1Cs, triglycerides are too high, and that suppresses the immune system. One Coca-Cola or glass of juice will suppress the immune system phagocytosis of white blood cells for 10 hours. So don't tell me that their diet doesn't matter. It does. And it is so accessible, this junk food sugar suppressing their immune system all the time. Then with ovulation or their monthly cycles, that's another immune stress, a small inflammatory moment. We call it Mittelschmerz, when you get this little mid-cycle of sensation of discomfort on one side or the other when each or the other ovary ovulates. That inflammatory phase can make it cyclical too and depress the immune system momentarily for a day or two. And then the late night watching of the YouTube with the blue lights suppresses the immune system. The cortisol stress acts as a chronic steroid, suppressing the immune system. The anxiety and fearfulness and lack of socialization and talking and touching and comfort and laughing. All these wonderful things and movement are being lost. Everything's being marketed to you instead of just eating good, normal food, good water. A good infrared incandescent lighting is now stupidly outlawed in this stupid socialist state of ours of California. And so it's an amazing thing that anyone is healthy. So that's what I think is going on for your daughter. Find out what her blood type is. If her blood type is A type blood, she needs to be on digestive enzymes when she eats her food. Find out her blood type. If she's an O type blood, then the corruption of the wheat grain and the dairy homogenized pasteurization is so immunoreactive to O type blood people. And this is what I've seen over 45 years of practicing medicine, doing all this natural medicine alongside my allopathic training. So that's where I would begin. Find a good functional doctor. Go to acam.org, acam.org. Chelation doctors who provide vitamin C, IVs, and chelation are ones who typically have open minds and hearts to try and find other ways to help their patient than the failed, pimped out, pharmaceutical controlled medical schools they were tricked into going to, and now they live a suppressive slave life to their limitations. These poor doctors, what a paradigm they live under. Let's see. Kimberly says, what would your recommendations be for a 30-year-old woman with a hemoglobin A1C of 6.1? Well, she's pre-diabetic right there. She's also concerned about her cholesterol. No need to worry about cholesterol. When you keep on injuring yourself with high average blood sugar spikes, you injure the endothelium, and your dear liver has to produce more cholesterol to repair all the micro damage you're doing all over your body. So that's a joke and misunderstanding. that was promoted by the pimped out pharmaceutical whores that run the medical schools that train your doctor to be just their robots. And let's see. So her blood type is O negative. So there you go. So this 30-year-old has been harmed by the glyphosated, genetically modified, sold out pimps to the food industry to promote them and make that the standard for the Food and Drug Administration in the dietary advice by a council of men who are on the food boards with conflicting interests that pimp out the cereals and the soda things, but the wheat in the cereals and the breads and the weekly pizzas available. All this junk food is very hard on the O, along with, of course, all the cheese that's on the pizza and so forth in their pasteurized, homogenized dairy. It's a rigged system, so you can sense my anger and my disgust in all my adjectives I use to describe the corrupt system that I have been able for all these 45 years to keep my patients protected from without the help. I didn't need YouTube and I didn't need the internet to do it. You can actually learn these things through reading. There's a thing where you put on your glasses and you open up a thing that goes like this, and it's called a book. And then you can look in the book and you can look at chapters and points and indices on areas you want to read about. That's called reading, and that's going to be a lost cause if we don't lift up the value of reading. Anyway, I'm getting worked up. Let's see. Here's another question Amela already put out about the thyroid. I answered that already. Marilyn says, plant-based diets seem to be everywhere. I know you don't support these. It's not that I'm against eating anything from a plant. It's just the marketing pressure of it all and the demonization of the health benefits of the most nutritionally dense foods in the world, like meat. So, yeah, I am biased, but I'm not anti-plant. Can you give us your thoughts? I am concerned about high acid with carnivore diet. That's a fallacy right there. High acid. So someone marketed someone to do some studies that would favor a setup of their scientific hypothesis that would guarantee an outcome of some acidic conditions. Now, when you read those papers critically, and if you have objective, scientific, open mind, you'll say, why don't you describe the type of cows that are being used for the meat rich diets? Were those cows fattened up and fed antibiotic laden, grain driven beef to fatten them up and put all these hormones and antibiotics in them? Then yeah, that's not what I'm talking about. I'm talking about real natural farming, grass fed. So there are so many different parameters that you can look at. The China study was a epidemiological book written about cherry picked data to demonize any animal-based food part of our diet and glorified the grains. And again, it was a cherry-picked epidemiological study. Very, very sneaky, very evil. So I recommend to my patients who have been unfortunately injured by this corruption, and now we have to try and remedy decades worth of damage. So I will recommend a carnivore diet, and that for typically a season, at least 3 months. And then on follow-up, we can talk about the results and how dedicated they were. If they were cheating, then they really weren't on a carnivore diet. And they introduced anti-nutrient, lectins, phytates, and stuff that are harmful and inflammatory. And we have to retry it again as a full carnivore diet. But in general, I am not 100% carnivore. I eat cooked vegetables. I made a beef vegetable soup that I'm going to eat for 2 days now. And I have what in it? Celery and onions. So I have onions and celery with a tomato paste and broth and seasonings with a lot of beef in it as well. So I am I'm largely have always been a carnivore because my father in food research. He brought home all the steaks and the hot dogs. So I am literally the image of the old commercials for Armor Meats. They said the commercial was Armor hot dogs. What kind of kids eat Armor hot dogs? Tall kids, short kids, kids who uh, uh, fat kids, skinny kids, even kids with chicken pox eat hot dogs. Armor hot dogs. The dogs kids love to eat. So I am that child, and I had chicken pox and measles, and I didn't have any vaccines and so forth. So I am a living example of my father learning of the corruption and trying to get his family fed with the tissue. We are made of protein and fat, not fruits and vegetables. Fruits and vegetables have minerals and micronutrients in them. I use Juice Plus, the most researched nutraceutical in the world for anti-aging on all sorts of body health situation, proven to be very effective on clinical studies. So this isn't third party gainsaying. This is the actual research on Juice Plus on populations of people. Plus, we've been giving it to children for about 20 years. Usually the children get on it for free for about 4 years. And we have millions in all parts of the world, all kinds of economic, economic factors, and we see improvements, academic, less allergies, better physical performance, less fat, insulin with it. So I am not against the micronutrients that are in fruits and vegetables, and I take Juice Plus, and I eat some cooked vegetables, period. So there you go. So that's my thought on that for you, Marilyn. And she went on to say, she's wondering if that's a strain to your system. Yeah, just eat grass fed, get a good functional doctor, talk about what you're doing, find out your blood type and so forth, and see if you need digestive enzymes with it. Harlow says, I just had a chelation done for the first time with a different doctor. I've had a reaction of feeling lightheaded and almost like a tingling on my face, vibrating feeling throughout my body, and I feel pretty shaky and flesh. Is this just normal? Water, 500 mLs, 20 mils of the EDTA. So he gave you a rather large dose. So B vitamins, glutathione. She had glutathione with it, and I don't know if he was using calcium disodium EDTA, disodium EDTA. Sounds like you were on the disodium EDTA, which can, with these higher doses of chelation, I use the lower dose because I don't want any reactions. We can do a little chelation more times, less concentrated. We do teach it that you can use 50 milligram per kilogram on a single dose, roughly 3 grams of EDTA. I only use 1.5 grams because I never want side effects from this. Remember, we're moving toxins out. It will clear itself out. But no, that sounds like he used a higher concentration and mixed glutathione with it. And I don't know anybody who has done studies of glutathione mixed in with EDTA chelation. I don't know the effect of that. Kathy says, hi, Dr. Ellithorpe, I'm taking systemic enzymes and digestive enzymes, right? Because there's systemic enzymes that work on the inflammation throughout all the body, and then digestive when we eat our food. And some of them are overlapped, protease, amylase, lipase. Yeah, systemic enzymes have similar enzymes in it that the digestive enzymes do. The one thing systemic enzymes never have in them is hydrochloric acid or ox bile. That ox bile and hydrochloric acid is only for digesting food and taken with food, okay? Is it okay to take both? The answer is yes, but keep the systemic enzyme on an empty stomach, far away, many hours away from eating any food. So it'll work on disinflaming the rest of your body. And then the next thing is, wondering if you're taking too much of these three main enzymes. No, I've never seen an excess ever in my 45 years of using these things. I have used enzymes all my life and with my patients, and I've never seen an excess of this. So, yes, I do know there's some duplication, but it's never been enough international units or fibrinolytic FU units to create any risk that I've ever seen in all my practice. How do you know if I have sufficient enzymes from those supplements above? Well, I do it by an exam, conversation, talking to you, see how you're feeling. And I look at inflammatory markers in your blood, like sedimentation rate, highly sensitive C reactive protein. I'm 72 now and I have no joint pain. And I'm working out 3 times a week. And I would say that's unusual to be in your early 70s without any joint pain anywhere on your body. And I think that's because I've taken enzymes and, of course, enough water every day of my life. And that this is structured water with my wand in it. Let's see, what's the next question? Kathy says, "Hi, Dr. Ellithorpe. I had a blood test for my blood type, and she's A positive. Okay, good. I heard blood type can affect how the body absorbs nutrients and building muscles. That is true. Can you explain more?" Well, A's, if you look at any of my notes, A's as a class of people just tend to not digest as well because they make less total enzymes. So they have less ability to chop up more protein and fats and incorporate them into tissue and muscle repair. Therefore, if you take digestive enzyme, especially if you're a blood type A, it's helpful. And all of us, like I'm a B positive blood. By the time I hit 58, 60 years old, I was not digesting as well. And so I knew at that time it was time for me to start taking digestive enzyme whenever I eat. So that is the reason why, Kathy. Hope that helps you understand it. Simone says, "Hi, Dr. Rita. Thank you for taking my question." You're welcome. That's what this is all about. What do you think about micro needling uh, with PRF, platelet rich fibrin? Okay, micro needling. Uh, and all of these lasers and light therapy for the skin. Have you done any of these because your skin is beautiful? Well, that's sweet. Um, yeah, I think I've just been drinking my water, exercising, not eating late, taking my enzymes. I don't shower or bathe, but once every 6 to 8 weeks, I sponge bathe in my pits every day. But I won't let water and soap get on my skin to take away my oils. My oils are my prize and what helps lubricate me. I'm on my natural hormones that help lubricate me. Doing this micro needling and putting fibrin in it, these are all more and more processed, so-called natural methodologies. It's another way for your dermatologist and esthetician to make money on you, that's for sure. And so I have very little respect for the process of doing it. We just don't drink enough water. And then if you look at one of the studies on Juice Plus, there was a 39% increase in the thickness of the skin epidermis in those who use Juice Plus. So we who are on our hormones, who are on the wonderful antioxidant Juice Plus with all those wonderful berry concentrates in the vineyard blend, who drink our water, who keep our sugars down, who don't eat late, who exercise to pump the circulation around, who take enzymes to chew up all the debris. This is probably what has done it. Spend your money on Juice Plus. I'd put that down 1,000 times over against any doctors helping them with their salary, with their micro, what is it called? Micro something or other. What is it called? Micro needling. Micro needling. Oh my goodness. When will we ever stop being pushed by a little talk about from our dear neighbor or our friend of some new hyped up marketing thing? Oh my. Don't do it. Do the good things first. And then if you're still having trouble with your complexion, after you've done all these good things, then you're going to go to these extreme methodologies. One thing that really ticks me off, like you want to know it, but I watch these infomercials because I know I'm going to get the question here or I'm going to get it in my office because that's all I do is see people every day of my life without ever taking off. And I saw one more recently. Chuck Norris and his wife are marketing something or being used for an infomercial. And they ask him, "What do you use, milk or almond milk?" They said, "Neither." "Well, what milk do you use?" And they go, "Oat milk." And I am just, you know, shocked at this being actually received by people who are adults who are supposed to be watching this and listening. Now, I like Chuck Norris. My little boy he signed a book when we were in Texas when I was doing research at Brzezinski's office on cancer treatments, and I was running the place while he was in court. And they ran into Chuck Norris at the bookstore while I was at work. My husband was there at the Barnes and Noble, and he got it signed. But Chuck, please, please, would you not try and represent yourself as knowledgeable on nutrition? You can do all the martial arts representation you wish, but you say oat milk when they hyper process this and they hyper concentrate all those genetic modified and glyphosated materials. Or if you are filtering those out, you didn't mention it so that all the people watching your infomercial, they wouldn't think of all the hyper processing concentration of glyphosates that are known carcinogens. So that's just one example of thousands of commercials going out all the time saying, "Here's the cure to your arthritis. Here's the cure to your macular vision issues. Here's the cure to your ringing ears." And it's marketing, folks, and it's in the alternative world, and it's just as corrupt and likely pimped out for money as anything else. So that's just the ugly truth. We got to deal with truth here. What else do I have? Susan says, "I've been a carnivore for about 5 months, and I've been having diarrhea for the last month." Well, one thing, check your meat and make sure it is truly grass-fed beef because some of this is mixed stuff, and then you might be reacting to the gluten that was in this grain pumped up the last month of their life before fat slaughter. I was having normal bowel movements prior to that. Do you have any suggestions for me? Well, check that your source. Should I introduce a little fiber? There's plenty of fiber in the collagen material there. That's another myth that you have to have fiber. I've tried backing off of fat, but still continue to have it. What is your blood type? If you're Susan, whatever your age and blood type, you might need digestive enzymes at this point. Thank you, and God bless you. I wish I knew who you were. So there's so many things I would think about to ask and examine for you. Do a complete digestive stool analysis. How much are you overdoing it on dairy, possibly raw dairy? Lots of things we could ask. Sandra says, "My friend's husband has Pseudomonas." I had this question last time, so I already answered that last week. That was Pseudomonas of the lungs. Sandra, do you think that the breast of a woman who has had chelation would show up on ultrasound and MRI with more blood vessels? No, not necessarily. No. Yeah, microcirculation is there and it's always there. It's just opened up and improved. It doesn't cause new blood cells to form. So that's the answer to that. Okay. Anything else here before we end? We're already overdue. All right. Mana says thank you. All right. To all of you, the Lord bless and keep us. And may we treat one another with the respect that they are created by God in his image. So please treat everyone with love and respect the best you can, even those who are breaking your heart or hurting you. Try to see beyond that and treat them with love. They need it. Touch them, hug them, and let your infrared touch their infrared sphere. And that is healing. Hugging is very healing. They say you need 12 hugs a day. So until next Tuesday at 6 o'clock, the Lord bless and keep you always, and take care. God bless everyone. Like and subscribe if you can.